Miscarriages after IVF. If you want to find out why miscarriages occur after IVF and how you can prevent this, please watch this video. I'm Dr. Malpani from Malpani Infertility Clinic, and our website at www.drmalpani.com has tons of information for IVF patients. A lot of IVF patients feel the worst thing which can happen after an IVF treatment cycle is IVF failure, to not get pregnant. But actually there is something worse than not getting pregnant, and that's getting pregnant and then miscarrying. This is terrible. It's like someone gives you something and then snatches it back. So you're anxiously waiting after the treatment as to whether you're pregnant or not. Those 2-week wait after the embryo transfer are finally over. Your beta HCG is positive, you're on top of the world, yes, I'm pregnant, and after a few months I'll finally have my baby whom I've been looking forward to holding in my arms for so long. And then you start bleeding, or the beta HCG levels don't rise, or the ultrasound scan shows no heartbeat, whatever it may be. Actually losing an IVF pregnancy is heartbreaking, because you've longed for this for so long, you've wanted this so much, and yet you've lost it. And I need to put some of this in perspective. The most important thing is that you should not blame yourself for the miscarriage, and this is the biggest problem. Patients always blame themselves for a miscarriage, and this is true whether they miscarried in the bedroom after having intercourse or whether they got pregnant after IVF and then miscarried. The natural tendency is always some sort of, I must have done something wrong. I lifted some heavy weight, I didn't sleep well, I slept on my stomach, I ate something hot, I ate something cold, I fought with my husband, 50 different things. And the reality is none of these are true. But because you're unhappy, because you're so emotionally vulnerable, you're always looking for explanations. And especially in Indian society, victim blaming is such a common problem for women who've had a miscarriage. Whether she does it or not, there'll be 50 other people who will blame her for it. Oh, you should have been resting. Oh, it's because you went to work. Oh, it's because you sat in a car and you went through a pothole and that's why you miscarried. Rubbish. How can any of these things cause miscarriages? If they did, then no woman alive would ever have a baby. What about all Indian women who work on farms, who continue having babies merrily? Nature has designed the human body with enough sense that once a pregnancy is established, it's not going to miscarry whether you lift something hot or you eat something hot or cold or whatever it may be. It's secure. Don't forget, the pregnancy was designed to be carried by the uterus for 9 months. It's a perfectly normal biological response. And just because you did IVF doesn't change anything. An IVF pregnancy is exactly like any other pregnancy. The embryo doesn't care whether you spend 5 days in the fallopian tube and then reach the uterus, or whether you spend 5 days in the test tube and then reach the uterus because the doctor put the embryo back in the uterus using a catheter after doing an embryo transfer. A pregnancy is a pregnancy, and nothing you can do will increase the chances of having a miscarriage. But remember, this also means there's nothing you can do to reduce the chance of having a miscarriage, and the fact remains that human reproduction is not very efficient. About 10% of all pregnancies are destined to miscarry, and I'm using the word destined very deliberately because it's just a biological fact of life. You could have 4 babies in your bedroom, and the 5th time you could still miscarry no matter what. Or you could have 4 miscarriages, and the 5th time you could go on to have a healthy baby. All these are random events. But it's easy to talk about randomness when it's happening to someone else, or when you're doing a scientific analysis and looking at the records of 100 women. But when it happens to you, it's heartbreaking, no question about that. And then you refuse to use logic or scientific rationale, and because your heart is breaking, you always feel there must have been something wrong which I did. And the worst thing is, IVF patients are already emotionally vulnerable. There's already convinced that there's something wrong with them. I couldn't even get pregnant in my bedroom. I needed to do IVF to get pregnant. Doesn't that prove that there's something wrong with me? And then when they miscarry, that reinforces their lack of self-esteem, that opinion they have of themselves that their bodies don't work properly. Not only could I not get pregnant in my bedroom, I couldn't even hold on to the pregnancy after I got pregnant. I'm a useless woman, never going to have a baby. None of this is ever going to work. And it's often the last straw which breaks the camel's back, and it causes women to become desperate, frustrated, and lots of women will then do all kinds of things such as doing surrogacy or something else, and whether they feel like doing it or not, they will be under so much pressure and so much frustration, and sometimes doctors will push them into doing surrogacy just because they've had one miscarriage after IVF. This is completely flawed reasoning. In fact, you should look as a miscarriage as a fact that you have got pregnant. The glass is half full. The very fact that you have got pregnant means obviously your uterus works properly, or the embryo would never have implanted in the first place. And the fact that you got pregnant means that your chance of getting pregnant again are much better, and that just because you miscarried once doesn't increase your risk of miscarrying a second time. Your chances are still very, very good. In fact, the odds are stacked in your favor that you will go on to have a healthy baby the next time. So your odds are in your favor. Remember that. The fact that you have got pregnant proves that you can actually go on to have a healthy baby. So there's really no reason to get disheartened. You just need to change the way you interpret things. You need to understand the facts and not let your feelings get the better of you. Honestly, if you hang in there, you will realize that you have an extremely good chance. So many women have miscarried after an IVF cycle and then gone on to have a healthy baby. And I understand that it's not possible to replace the loss of a pregnancy. That will remain a part of your life, but it could actually be a stronger part of your life, a part of life which gives you hope that yes, I can become a mother. Because remember, the commonest reason for a miscarriage is there's something wrong in the embryo, in the fetus. And usually this is a genetic problem, which we have no way of testing for, no way of preventing. And then a lot of people say, oh, but can't you do genetic tests on the embryos to prove that the embryos are normal? Isn't there something called PGT or pre-implantation genetic testing where you can test that the embryo is genetically normal and then put that back? I wish we could, but the reality is we can't. The technology is very primitive. When we do a PGT, all we can do is test the number of chromosomes. There are only 23 pair of chromosomes, so we can screen for aneuploidy. So we can put a chromosomally normal embryo back into the uterus. But just because it's chromosomally normal doesn't mean it's genetically normal, because there are 23,000 genes, and even a PGS normal embryo could have a lethal genetic defect which we can't test for. We don't have the tools to do so. So understand the limitations of the technology, and also understand that there's no reason for you to blame yourself. And also remember that if you have got pregnant, your chance of getting pregnant again are extremely good. If you have questions, please feel free to reach out to me. I'm Dr. Malpani. Our website is www.drmalpani.com, and I'm happy to offer you a free second opinion. And we look forward to helping you to have a baby.